Morning. Today we'll be discussing two healthcare apps that impact patient care in different ways. I will be taking a dive into the VA Health and Benefits app and the GoodRx app. We will be specifically looking at these two apps in regards to the relevance to patient care, usability, cost, function, compliance to federal EHR regulations, and their implications for the APRN. So let's start with the VA Health and Benefits app. Its relevance to patient care. As a veteran, I use this app fairly frequently. The app was developed for veterans and addresses the unique healthcare needs of that population. The app offers veterans direct access to VA health services, including appointment and scheduling, medication refills, access to medical records, and the creation of this app stemmed from the need to improve access to VA healthcare and to reduce wait times, as well as to help veterans manage their health and records in a more accessible way. As far as their compliance to federal EHR and HIPAA regulations, ease of access to medical records and direct communication with provider is great, but it does come with concerns for breaches in security, leading to leaked patient information. The VA Health and Benefits app is completely HIPAA compliant and secure for use. It abides by federal mandated regulations for EHRs, and they utilize encryption software and secure login procedures for better protect sensitive patient information. As far as usability, the VA Health and Benefits app does leave a lot to be desired. Users, including myself, find the app to be clunky, hard to navigate, frustrating to use, and plagued by functionality issues. There are an unnecessary amount of clicks required to access some of the most basic features, such as viewing patient records or past lab results. While the app is useful, it could use a complete overhaul to make it more accessible, especially for those who aren't tech savvy. Comprehensiveness and user satisfaction. The VA Health and Benefits app is not well loved by veterans. There are some that are truly grateful to have an app that they can access their information in, because calling the VA to gain this information can be equally, if not more, frustrating on occasion. So using this app does eliminate the added frustration of dealing with a person on the phone. Others, though, would prefer to deal with the VA employee and avoid the app altogether. Functionality aside, though, this app is fully comprehensive. It gives veterans access to visit notes, lab results, radiology reports, appointment reminders, appointment scheduling, medication refills, VA related service connected disability paperwork, and resources for who to contact for services not only for medical care, but also for general VA benefit and programs. It is a one stop shop for all your VA needs. Cost. So let's get into cost. The app is completely free. There is no cost associated with the download or use of this app. While free, the VA Health and Benefits app is limited only to veterans and family members enrolled in VA healthcare. As far as implications for the RN or the APRN, this app does allow you to have direct communication with your patients so that you can access or discuss lab results, care plans, and general recommendations for their health. The downside is that you may be the one responsible for trying to help your veteran navigate that tool so they can benefit from its features. If you and your veteran can both get on the same page with how this tool will be used for their health care, then it can be beneficial in improving the patient provider communication. So, the next app we're going to talk about is the GoodRx app. Its relevance to patient care. This app helps patients find their prescriptions for the lowest possible price in their communities and offers coupons to get an even further reduced price. This is useful for low income patients, uninsured patients, or patients with insurance that have high deductibles. Prescription medications are often expensive, and this app helps improve patient compliance by reducing the cost burden. It was for this reason that this app was created. Now, as far as compliance to federal EHR and HIPAA regulations, GoodRx unfortunately does not comply with federal mandated HIPAA regulations, and in fact was sued by the Federal Trade Commission in 2023 for violations of privacy practices by selling user data without users' permission. They settled with the FTC for $1.5 million and were required to make changes to their operation, such as not selling user data, not storing user data, and maintaining a comprehensive privacy program. As far as usability, GoodRx is intuitive and easy to use. All you have to do is enter the name of the medication and select your location, and the app will provide a list of every pharmacy in your area that has this medication and its price. Cost. So GoodRx has a free and a subscription-based option. Both offer reduced prescription prices, but the paid monthly subscription has even deeper discounts at certain pharmacies. Comprehensiveness and user satisfaction. GoodRx is a limited app that really only covers prescription drug pricing and discounts, so I wouldn't consider it a fully comprehensive healthcare app. User reviews of the app tend to be very positive, with very few having issues with functionality or usability. As for its implication for the APRN, APRNs can use this app to help patients find discounted prescription medication and in turn increase the odds of medication compliance. It is worth noting that it is important to let patients know about the security issues associated with this app and encourage them to investigate this if they have concerns. Overall, this app can be very beneficial for both patients and APRNs. So, in conclusion, both apps are useful for patient care and provide different vital services. The VA Health and Benefit app is a full scope healthcare app that allows a veteran to have better access to their provider and medical records, whereas GoodRx offers patients medication discounts and helps improve medication compliance. Digital based healthcare apps are wonderful tools that improve quality and care of patient provider communication and should be considered as an essential tool for the advanced practice RN. Thank you.